Hi everyone, I'm Andrew McIntyre. I'm a gastroenterologist on the Sunshine Coast, or at least I was till December last year. I'm now a cattle farmer. But the purpose of being here is to give you an update on a case we call Doctors Against Mandates. There's about 15 of us from all different specialties who have decided to take on the chief health officers and the mandates. So there's a lot more people behind it who were not game to put their name up, but there's about 15 of us on the case, and the case is already in. The affidavits from the expert witnesses are due in at the end of next week and will be submitted to the court, and then they will respond. We've already had a response from the Chief Health Officer, and I think someone needs to take his degree away because it's absolute rubbish. But the defence is just lacking. All he gave us was a list of all the restrictions with no justification. And, you know, it's a very poor defence, so I'm not quite sure what he's up to. And I know a lot of people don't have much faith in the legal system. And we're not entirely convinced that it's honest, but I think we can be intimidated out of trying, and that's a mistake. We need to give it a go. Because if you look at the evidence, it's overwhelming. There is no possible justification for the mandates. I'm sure most people are aware of the evidence, but now we're in the Omicron area. The vaccine is totally ineffective, and in fact it has negative efficiency. So a lot of the healthcare staff who've been double vaxxed would have a higher risk of COVID than people who weren't vaccinated at all. And if you've had COVID, your risk of COVID is 1/13 of someone who is double vaxxed. So a booster lasts about 4 weeks, after 2 weeks of being more susceptible to COVID, and then after that you become more susceptible again. So in fact, the mandates are probably likely to increase the risk to the public, let alone the adverse events on healthcare staff and the lack of staff in the hospitals because of vaccine injuries. The effectiveness is probably negative. It's certainly not greater than zero. So the science is there to prove that. It's a matter of us putting it before the court with expert witnesses, and that's what we're doing. I mean, it's probably a few $100,000 effort, but I figure if you are going to own nothing and be happy by 2030, we might as well do it now. So we're certainly not happy to just leave it alone. It needs to be tackled, so that's what we're doing. So, and as a promo, we do have a website, doctorsagainstmandates.com, and we've got about $70,000 donated from less than 300 people, which gives you an idea that people have donated significant sums, and we've had like $5,000 donations from some doctors, which is great. But we would like to see the number of donations a lot higher as an indication of support, and we know that people are financially stressed, but a $5 donation increases the number of people who are showing their support, and I think that's important. So we'd encourage people to, you know, make a small donation and just up the number of people behind it, because I think when it ends up in court, that figure will be taken into consideration. So we understand that people don't have a lot of money to spare, but just a number there behind it would make a significant difference. So apparently by September it should end up in court. That's the aim, and we've got no guarantee of success, but it is something that does need to be tried. And the evidence is overwhelming. It's just that there's no avenue to present the evidence to anyone at this point in time. Mainstream media won't broadcast it. I mean, so it's there on social media, but this is an opportunity for it to be in the public forum and hopefully reported on, and hopefully we can win, because it makes absolutely no sense. So I'm sure there's a lot of double vaccinated healthcare staff who don't want to be mandated, and just a little bit of inside information. Actually, yesterday I got my hands on a confidential Queensland health document, which I don't think should be confidential, saying that when the state of emergency ends in October or whatever it is, they're planning on passing laws to allow them to continue mask and vaccine mandates for at least a year after that. So it's not going to end, it has to be fought for, so that's my message, and I just get you to wish us luck, but we're certainly trying hard to win it. Thanks everyone.